Hello guys, I'm Tom Herbetko, physical therapist and osteopath, and today I'm going to show you guys how to stretch your shoulders, when you have tension, when you have pain, when you have numbness in your hand possibly, and so on. So as I showed you guys in my other videos, like the importance of stretching the neck because the shoulder, also the hand area is innerved comes from the brachial plexus, which starts in the cervical area, the lower cervical area. So one stretch we can do is bringing our hand back, always doing, keeping the chin in, taking a deep breath, and we can stretch the interior fibers by looking up. I'm just going to show these neck stretches quickly because I want to concentrate more on the shoulder, but just to review, so always looking up. If you look, the more you look up, the more you stretch. Then you can use the lateral fibers and you can stretch that out laterally too. Always breathing, and we hold for about 30 seconds. And the last fiber is the posterior fibers, posterior nerves. We're going to hold that also for about 30 seconds. So once we get that released, we're going to work on really important the pectoral muscles. Okay, so the pectoral muscle is a muscle which has importance in shoulder pain because the plexus actually passes around underneath the chest muscle and goes and innervates the shoulder and the rest of the arm area. When we are sitting in our offices or sitting in our quarantine and we have our shoulders rolling forwards, what we're going to do is compress that area. So the first one we're going to do is on how to open up the shoulder area, the pectoral muscle. Basically using the wall, we're going to pin our shoulder to the wall. You can always use the other hand to add a little bit more stretch, and we're always breathing. When we hold this for about 30 seconds, always making sure that the shoulder is on the wall. We can then with our fingers we walk up a little bit, maintaining that shoulder there, and we're gonna stretch different fibers of that shoulder area. Always breathing and holding that for about 30 seconds. Next, I'm going to show a really important stretch for actually the brachial plexus. So what I'm going to do is put my hand horizontally on the wall. So horizontally is like this, not like this. And it's going to be about the same height as my shoulder. Okay? So what I'm going to do with my bicep now is I'm going to rotate my bicep inwards, leaving my hand horizontally on the wall, keeping my chest out. Take a deep breath, and when I breathe out, I'm going to roll that elbow down. Okay, and then the third part of this stretch, what I'm going to do is imagine I'm trying to separate that arm from my shoulder area. And then I'm also going to go the other way with my head. The other arm can open up too, just to open up a little bit more. And I'm going to hold this stretch for about 30 seconds. You might feel your hand a little bit numb. Just go like this a few times. Like if you were like a wet towel, and it should come back to normal. Okay, the area. Well, that's good. That means you're stretching it. Okay, so next shoulder stretch is quite common. You probably see this all around, and I'm going to take my shoulder. I'm going to lower my shoulder from my ear. So anytime I'm stretching my shoulder area, I want to separate this area. Why? Because if I do this, I'm going to close in those nerves. I'm going to compress those nerves. I don't want to do that. I want to do the opposite. I want to stretch them. I'm going to hold my shoulder just beneath my shoulder, and in the direction where I'm pointing, I'm going to kind of do a little bit of a traction, separating my arm from my body. Okay, so always breathing. A variation I can do is put my hand back and then separate it even more just to stretch out a little bit more different fibers from there. I'm going to hold this for a while, about 30 seconds, until I notice that release. Okay, next up, we're going to stretch the, as you know that there's a connection between the hip and the shoulder area. If you didn't know, now you know, through the lats, through the latissimus dorsi area. So you want to get that stretched out too. If not, that's just going to be pulling our shoulder down and causing more tension. So one good stretch we're going to do is, we're going to take our elbow and we're going to separate it from our hip. Okay, so a lot of people have, for example, elbow pain that they come to my clinic, and when I do the diagnosis and everything, I see that they have problems in their hips. So that's creating tension with the latissimus muscle and causing shoulder problems at the same time. So to stretch out just a lat, I would be with my hand that's straight. I'm going to add in the tricep. I'm going to bend it. And then if I want, I'm going to separate a little bit more, always breathing. Okay, so again, if you just want to stretch the lat, you kind of open it up, open backwards, because if you go forwards, you're not really stretching the lat. And then if you want to add in the tricep, which connects with those fibers, you do that. Another tricep stretch, which is really similar, is just a little bit changing the angle, is pushing my tricep back. And then you're getting a little bit different fibers in that stretch. So we're going to do another shoulder stretch. It's actually from the back area. And crossing our arms just like this. Okay? So cross our arms. And now the error in this, the mistake is that people bend their back, they round their back. Want to keep your back straight. You can lower your elbows a little bit, lower your shoulders to get an even stronger stretch, and then kind of push your elbows forward. Excuse me. So you pull your elbows forward, breathing the whole time. Okay, so we're going to hold this. And then afterwards, you do about 30 seconds, and then you change the hold the same, but you just hold it differently. Okay, another variation of this, which is a really easy exercise, and sometimes we need, now in these times, we need some love, is the self-hug. Okay, so I'm going to try to get back, try to reach back for the scapular bones. I'm going to try to separate my shoulders from my ears, okay, because if I close it in, I'm closing in those nerves. I don't want to do that. And I'm going to be breathing the whole time. Okay, and one more excellent stretch, and this is for the rotator cuff. Okay, the rotator cuff usually is weak in patients because there's too much forward shoulders, but what it does is it reacts with tension itself too once it's weak. So if you want to stretch it just to get rid of the pain, an excellent stretch is putting your hand on your side, okay, just above the hip. It shouldn't go behind your back, because if it goes behind your back, you don't have much of leverage. But if I have it on the side, I can get a lot more leverage in. So what I'm going to do is the same. I'm going to lower my shoulder to the ground, and I'm going to bring that elbow in as much as I can, keeping my back straight, keeping my neck straight, never crouching over like this. I'm going to try to always maintain good neck posture while I'm stretching, and I'm breathing all the time. Very important tip is to concentrate on the pain, on the fibers that are stretching, and the pain will go away really a lot quicker. So concentration is key in stretching. You shouldn't be thinking about anything else except for those fibers. Okay, so another important tip is we always, when we stretch, we release very slowly, because if we release quickly, what we're going to do is tense up the other side. What we're going to have a rebound effect. So the muscle that we're trying to stretch is going to kind of, if we release really quickly, it's going to just go straight back, and it's going to maybe even tighten a bit more. So we have to kind of give the release. We have to do the release slowly. And shoulders are really related with wrist, because when there's tension in the shoulder, all the nerves have no passage, so you might have pain in the nerves. So we can do one more just for wrist. So we're going to separate also your shoulders while we do this, while we hold out, keeping your chest straight. And variation is pulling arms back again. Okay, so at the same time, remember, I'm not raising up my shoulders to my ears. I'm trying to lower them, because I'm trying to separate those nerves from my ears. Okay, guys, so it's a good idea to do this. Well, you do it on one shoulder, you do it on the other, a few times every week. I hope you guys get rid of those pains. I hope you guys are not having a bad time, a good time doing exercises and doing what you can in these times, these really strange, weird times. But hey, we're gonna overcome it. So guys, thank you, and talk to you soon.